Hi, I'm Dr. Motamedi, a practicing family physician in Vancouver, Canada. Today in my email, I got this news. The most recent data published by CDC, Center for Disease Control in the United States, is showing that the prevalence of ADHD, adult ADHD, is about 6%. When we translate this to numbers, the estimate number of adult population in America who is living with ADHD would be 15.6 million. In Canada, this number would be 1.9 million people, adult people who are living with ADHD. Other data is showing that about 80 to 90% of these people are not diagnosed. So there's a significant number of people who are missing the diagnosis. Today, I want to talk a little bit about ADHD diagnosis and how I approach to this in my practice. As I said before, unfortunately, to this date, we don't have any kind of blood work or imaging that confirms this diagnosis. A couple of days ago, I had a mother who had paid a lot of money for a brain map to diagnose her son. I'm not sure about the uses of brain maps, but for sure it's not useful for ADHD diagnosis. So this is all just waste of money. So what do we do for ADHD diagnosis? We are still relying mostly on the information that we collect through questionnaires and a clinical interview. So there's one questionnaire, Adult ADHD Self-Report Scale, which is a great questionnaire for screening. It's not for diagnosis, but it's a very good start. Most of the times we need to see these people regularly, at least for a few more times, in order to confirm the diagnosis. So now the question is, who can make the diagnosis and who cannot? In Canada, the healthcare professionals who have some minimum training can diagnose ADHD. These include GPs, general practitioners, family doctors, psychiatrists, pediatricians, neurologists, clinical psychologists, even nurse practitioners can make the diagnosis and can treat. In some countries like the UK, only psychiatrists can diagnose and prescribe medication. It's unfortunate that the training on adult ADHD is limited in those countries as well. We have social workers, we have counselors, including school counselors, occupational therapists, who are excellent gateways to identify potential children and adults with ADHD and suggest them for further investigations, although it's not in the scope of their practice to make a formal diagnosis yet. Now the question is, what kind of information do we need to come up with a diagnosis? So as I said before, we rely on questionnaires a lot. In case of children, we send questionnaires to teachers. So they will give their observations of that child to us. There are questionnaires that parents will do. If they are older children, there will be some questionnaires that they will complete. When it comes to adults, we need information from their childhood. So we send questionnaire to a family member, someone who remembers their childhood. It could be a parent, could be a sibling. We also need information about their current state. So a questionnaire will go to someone who knows you well as an adult. It can be a partner or a very close friend or a long-term roommate. One of the most important part is mental health conditions. We have up to 80% comorbidity with other mental health conditions, so including anxiety disorder, depression, bipolar disorder, addictions, PTSD and trauma is a big one. So we need to screen these people for all mental health conditions. It's not just ADHD alone. We need to know if there is any history of ischemic heart disease, like a heart attack or stroke, having history of obesity, diabetes, high blood pressure. These are important to know. Also, having a history of seizure or epilepsy in the past, or glaucoma, high eye pressure, or significant concussions in the past will help us both in diagnosis and also planning for further management. It doesn't matter what age they are. If we have any concerns about ischemic heart disease, or if they have history of seizures in the past or glaucoma, I would refer these people to specialists like cardiologists, ophthalmologists, neurologists, to clear them for further treatment if they need to. I need to emphasize here that based on my experience of all patients that I have referred to specialists, heart or neurology or ophthalmology, all that, all of them have come back clear for treatment if their condition is controlled. If they are receiving appropriate treatment for their heart condition, for their eyes, or for their seizures, it's okay to go ahead and start treatment if they need to. So when it comes to family history, again, we need family history of both physical illnesses and mental illnesses. For physical illnesses, I ask if there is any early age heart attack or stroke or sudden death. I also ask if there is anyone diagnosed or suspect ADHD, bipolar disorder, or autism, addictions, any history of hospitalizations due to mental health conditions, and suicide attempts. I don't ask about family history of depression and anxiety because everybody is diagnosed with depression and anxiety. It's not useful. When it comes to investigations that we need to do, there are general basic lab works that we request for everybody for any mental health condition, including iron deficiency. We check for thyroid diseases that may mimic some symptoms of ADHD or depression or anxiety. But other than that, when it comes to children, if child is healthy and if there is no concerns about their health, I personally don't send them for any blood work because in my experience, this drawing blood and the needle itself can cause like lots of trouble and mini traumas for these children, and it's not worth it. When it comes to adults, I ask for most recent blood work. When did they do? If there is obesity, diabetes, high blood pressure, or concerns like that, we need to have more comprehensive blood work panel. Otherwise, if they're healthy younger adults, we may even skip those detailed blood work as well. For adults, we don't need to ask for EKG, electrocardiogram for everybody unless we have some concerns. Another thing that we need to have in mind is about older adults. Nowadays, we are seeing older adults, people who are reaching out for diagnosis, like in their 70s and after 70s. So the first thing that we need to rule out in these conditions is dementia. There are a few points that help us in diagnosis. One of them is a high level of heritability. We know that it's up to 78%. So if there is a diagnosed case of ADHD in family members, it's really helpful for us. In the clinical interview, we will be listening to their life stories as we go over the questions. all their problems, their failures or struggles that they have had throughout their lives. I highly recommend we start with more straightforward, more simple cases by just screening them and then listening to their stories. Over time, you will find the patterns, the similarities between the cases, and you will gain the experience you need to help you with the diagnosis of these cases. It's more about the mild cases, especially when there are comorbidities, which is very common. The diagnosis can be more difficult. We can always refer these patients if we are not comfortable. Is it possible that we misdiagnose someone? Yes, even the most experienced practitioners can misdiagnose. That's why it's very important that we see these patients regularly for follow-ups. It's not, in my opinion, having an assessment done only, especially if there's just one questionnaire, is not enough, and the chances of misdiagnosis will be higher. That's why I highly recommend screening for other mental health conditions at the same time we are screening for ADHD. In my next video, I will talk about the challenges that we have in diagnosing people and also the consequences of not diagnosing people. Stay tuned.